knows the end from start. What an awesome God. Awesome, awesome God. What an awesome God. By him things were.
I'd like to thank the Honorable Minister and Honorable Commissioners, representatives for such kind words and pledge of support. I will definitely be calling you to make good on your pledge of support today, because we will need your support as we go forward. I'd also like to thank our distinguished ladies and gentlemen, our excellencies, our former governors, our royalty in the rooms, family, friends, and all those who traveled a great distance to come here today to celebrate the 80th birthday of my father, Dr. Gabi-Williams. And it is indeed an honor for me to be giving the inaugural lecture of the Gabi-Williams Alzheimer's Foundation. I have entitled it, The Rising Tide of Alzheimer's Disease. Now, we have all forgotten a name, where we put our keys, where we put our eyeglasses, if we lock the front door on the way out. It is normal to lose things once in a while. Forgetting which day it is and remembering it later in the day is okay. But forgetting what year we are in, or where we are at a particular moment in time, is not okay. The key question to us is, are these things happening once in a while or all the time? This is why families generally underreport dementia symptoms. Many confuse them with normal signs of aging. Symptoms in some cases emerge so slowly that the person affected does not even recognize them. And the person may be aware of these symptoms, but goes to great lengths to conceal them. Or families, quite frankly, conceal and hide them out of fear of social stigma and embarrassment. Baba is just getting old, they say. But Baba is not getting old when his memory problems make it hard for him to do everyday things. So it is important for all of us to understand and know what the symptoms and signs of abnormal cognitive aging are. My public health team at Columbia University in New York came up with an acronym, 4 letters, FLOW, flow, which helps educate families on what these symptoms are. The F stands for forget. People forget easy words and conversations. They forget familiar faces and places. They forget that they just said something or asked something. And sometimes they repeat themselves, not realizing that they're doing so. L stands for lose. People lose important things all the time. They lose their way getting around familiar places, or they lose interest in their usual activities and don't want to go out of the house any longer. The O stands for overlook. People overlook regular chores, like cleaning or paying the bills. People overlook safety issues. They leave the burning stove on. Sometimes they don't dress appropriately for the weather. And people also may overlook taking their own medications. The W has 2 meanings. The first is right, and the second is wonder. People begin writing lists down all the time to remember very easy things. They use reminder notes or to-do lists so that they can keep up with their activities at work. W stands for wonder. People may start wandering around with no place to go. They might get lost in familiar environments, or they might put themselves in danger in the process of getting lost. But as caregivers of Alzheimer's disease know all too well, Alzheimer's disease is not just about losing memory. It can also cause behavioral symptoms that are a great source of caregiver distress, caregiver exhaustion, caregiver hopelessness, poor grooming, poor personal hygiene, severe anxiety, restlessness, severe depression, aggressive behavior and sudden outbursts that are uncharacteristic for that individual, sexually inappropriate behavior, sleep disturbances, a phenomenon called sundowning, where every evening when after the sun sets, the individual becomes agitated, confused, and even more restless. And sometimes seizures can even be a part of this course. But caregivers often work in a culture in which it is largely unacceptable to talk about feeling exhausted or even feeling overwhelmed. Instead, their role is regarded as duty. But things can get out of control, so much so that 1/3 of patients with Alzheimer's disease require antipsychotic medications just to control these behaviors. Some of them include haloperidol, risperidol, quetiapine, olanzapine, many of which my father was on. And yet, we're lucky that we can even afford these medications, and we have access to these medications. Because in many cases, the average Nigerian cannot afford these medications and doesn't even know that there are medications out there that can suppress some of these behavioral symptoms. If you remove the brain of a patient with Alzheimer's disease, as an autopsy shown here, you can see that the normal brain is a lot larger than the diseased brain. With Alzheimer's disease, the brain shrinks. The cortical folds shrivel up, so much so that the ability of the individual to think, plan, and remember is devastating. When we look deeper at the brain of an Alzheimer's patient under a microscope, we see abnormalities that were first described by Alois Alzheimer's disease, who was a German neuropathologist and psychiatrist working in Frankfurt back in 1907. He was working in an asylum in Frankfurt. And he discovered these abnormalities in the brain. And there were two classic abnormalities inside the brain that he found. The first are called neurofibrillary tangles, and they contain a protein which accumulates inside the brain cell of a patient with Alzheimer's disease. And the second is the so-called amyloid plaques, and these build up between the brain cells of a patient with Alzheimer's disease. And the more of these abnormal proteins exist in the brain, the worse the dementia. But why does it even matter to make the diagnosis of Alzheimer's disease appropriately? Why can't we just attribute it to getting old? One of the most important reasons why it's critical to make the diagnosis is because there are reversible causes of dementia. In fact, about 9% of people with dementia symptoms have other conditions that are eminently treatable, that are reversible. However, some of these reversible conditions are life-threatening, while some are not. It is also important to make the diagnosis because the symptomatic treatments that do exist for Alzheimer's disease, and I reiterate that there is no cure, but there are symptomatic treatments that may aid memory and cause temporary remission over a couple of years. These treatments are best started early on in the course of disease. If you start these treatments too late, the benefit of that medication is lost. So early diagnosis allows early initiation of these treatments, which can give you another 2 to 3 years, or maybe more, of better memory, better thinking of the Alzheimer's patients. Again, my father was on these medications, and he actually improved in the first few years while on these medications because we were able to start these medications early. And the final reason why diagnosis is very important is because while still cognitively competent, it allows the individual to plan, to state his or her wishes. How do you want to die? Make sure that your will and your house is in order in anticipation of what is yet to come. And it also helps the family prepare for the journey of life as a caregiver. When diagnosing a patient with Alzheimer's disease, the first step is usually to document the history of the symptom evolution. Alzheimer's disease does not start in days. It does not start over weeks or months. It usually creeps up over several years. And so the history it's important to take and correlate with Alzheimer's disease. The second is to conduct a physical exam, because there are certain clues on the exam that can point away from Alzheimer's disease towards a more treatable condition. The third is a battery of cognitive tests that can reveal patterns consistent with Alzheimer's disease. Following this physician examination and evaluation, the next step includes blood tests. And these blood tests allow us, again, to diagnose treatable conditions. It also, and I should just give a caveat, I had one patient once who was diagnosed with Alzheimer's disease, came to see me, family was devastated by the diagnosis, and the patient had a thyroid disorder. When I treated him with thyroid medications, his memory improved, and the Alzheimer's diagnosis no longer exists. So it's critical to make the diagnosis. A CT scan or an MRI scan is also very useful because it helps us exclude certain conditions that might be life-threatening. However, again, we were fortunate to be able to afford these tests for my father. The average Nigerian finds it hard to come up with 85 or 90,000 naira for an MRI, or even 40,000 naira for a CT scan. The average Nigerian finds it hard to access the relevant specialists with the ability to treat Alzheimer's disease. Other tests that we do routinely in America are not even available here in Nigeria. One includes the biomarkers that the Honorable Minister's representative mentioned earlier, which allows us to make a more specific diagnosis through a spinal tap and an examination of the spinal fluid. These biomarkers are not available in this country. Another test that we often do is a test called the PET scan. And this allows us to make a very accurate diagnosis of Alzheimer's disease, especially when the diagnosis is in doubt. And the PET scan can also allow us to make the diagnosis in people even before the symptoms appear or become severe. Tragically, again, there is no cure for Alzheimer's disease. But there are 5 approved medications that are available in Western countries that treat the symptoms of Alzheimer's disease, temporarily helping your memory, helping your thinking problems. But again, these drugs are largely unavailable in Nigeria, except for those in sporadic pharmacies that may privately import them and subsequently charge retail prices unaffordable to the average Nigerian. But there is hope on the horizon. In December of 2016, a successful research study of a drug called aducanumab for the first time demonstrated real progress in our ability to slow this disease. This drug was tested, however, in patients who were pre-symptomatic, patients who had not yet developed symptoms or who had only very subtle symptoms, subtle memory loss. These patients were diagnosed by a PET scan, and they were started on this medication, which clears the abnormal amyloid protein from the brain. And the study was positive, but it was a phase 1 study. And in research study, it takes 3 phases for a drug to go from the testing to the approval phase. We are now in the phase 2 period of this drug, and we hope that if it does as well as it did in the phase 1, within the next 5 to 10 years, we should have a drug that can arrest Alzheimer's disease once and for all. It's important for everybody here to understand who exactly is at risk for developing this disease. The most important risk factor is age. Starting at age 65, the risk of developing this disease doubles every 5 years. By age 85 and older, between 25 and 50% of patients will exhibit signs of Alzheimer's disease in Western countries. But in Nigeria, I should point out that the average life expectancy is only 54. You know, it's number 16. It's number 16 in Africa. Number 16 in Africa. So this room doesn't represent the average Nigerian. But the good news is that it is rising. Due to the efforts of the private public sector and the efforts of society and government working together, we are now seeing that life expectancy rise. But what does this mean? This means that we need to anticipate the oncoming storm of Alzheimer's disease, because if we don't, we might be caught unawares and unprepared for this condition, which is a condition that disproportionately affects those who are older in age. There is unfortunately a paucity of rigorous, and I use the word rigorous, epidemiological data regarding the prevalence of Alzheimer's disease in much of sub-Saharan Africa. In fact, Nigeria actually has the most epidemiological data on the disease on the African continent. And the landmark studies were really conducted by Professor Oguni, who was supposed to be joining us today. And he conducted 2 studies, one in 1995 and the other in 2006, 10 years apart. And he showed in 1995 the prevalence was about 2.3%, and this increased to 10.1% by 2006. So if you continue to project that line, you can see that that prevalence is rising very quickly, which is why it's very urgent that we have a robust plan to address Alzheimer's disease, which is why we are particularly excited to be able to partner with the Lagos State government, with the federal government, as a private foundation to really help champion the movement of the needle when it comes to Alzheimer's disease in Nigeria. And so, indulge me for a second and allow me to propose a 5-point national plan for Alzheimer's disease. Goal number 1 is, I believe we need to identify research priorities. The major research priorities should focus on epidemiological surveillance regarding incidence, prevalence, risk factors, mortality, morbidity, and also research that facilitates the translation of these research findings into public health programs. Goal number 2 is to enhance the quality of care and efficiency. This will require a multi-tiered approach. It would require adequate supply of professionals with appropriate skills, ranging from direct care workers to community health workers, to social workers, to primary care providers, and home care workers. The second piece will be to create well-equipped centers of excellence across Nigeria. I believe President Obasanjo established UCH in Ibadan as a center of excellence when he was in power. But I believe we need to establish centers of excellence across Nigeria and make sure that they are well equipped to handle the management and diagnosis of Alzheimer's disease. I also believe that we need to increase access to affordable drugs and improve and integrate long-term services, including home care, for families and individuals living with Alzheimer's disease. Goal number 3 has to be to improve caregiver support. Caregivers are desperately in need for resources and training. Look, I'm going to speak frankly. If we, the Gabi-Williams family, with the blessings that we have struggled with this disease, can you imagine how hard it must be for an average Nigerian who doesn't have a tenth of the privilege and honor that we have had as a family? Can you imagine how hard it must be for the average Nigerian? We suffered as a family. It was very, very difficult. And yet, there are people with this condition with much less than we have that are abandoned and left to fend for themselves. And so caregiver support is my goal number 3. Goal number 4 is to improve public awareness and engagement. And I believe we are starting this very goal here today. It is a foundational goal because an empowered public is a public that will work synergistically with policymakers and healthcare professionals. It is very important for us to improve the awareness of this condition. In fact, many people don't even really know what Alzheimer's disease is. Many people cannot even explain the difference between abnormal aging, when are these symptoms normal, and when are they abnormal. So improving public awareness is going to be very critical for our ability to encourage them to even seek help. They have to know that they have a problem. And the 5th goal is to improve data infrastructure and quality. And this is important because it will allow us to monitor and to evaluate the progress of a national plan. So the Gabi-Williams Alzheimer's Foundation is committed to supporting all of these goals. We will do so by creating an inventory of physician experts and local researchers in Alzheimer's disease and related disorders, and provide opportunities for dementia-specific research training in collaboration with Columbia University's College of Physicians and Surgeons. Before I came to this country for this event, I've already began making plans with Columbia University, who is ready to open their arms to help support training in research endeavors of young Nigerians who are interested in this disease. It is also very important to identify and help strengthen the available patient and caregiver infrastructure in Nigeria. And I have alluded to how we are going to address that. And finally, the issue of stigma cannot be overlooked. The issue of embarrassment cannot be underestimated. The issues around what will people say cannot be underestimated. If we don't bring this disease out of the shadows will engulf us as we battle alone in secret with this disease. You know, I have seen and treated many, many different diseases. Disseminated cancer with chemotherapy and radiation, massive strokes, blood poisoning by a variety of infectious diseases, devastating pain syndromes, muscle wasting diseases. But in my experience, none of these conditions that I have treated come close to being as cruel as Alzheimer's disease. It is a protracted, slowly debilitating condition that smothers a man's soul, turning him from a once vibrant, productive member of society into an unrecognizable person. a once gifted orator, is no longer able to communicate his needs or even speak to me. But we refuse to allow Alzheimer's disease to define my father. Instead, we have created a foundation in honor of his name to fight back against this vicious disease. This, ladies and gentlemen, is the Gabi-Williams you all know. Distinguished, brilliant, generous, funny, wise, a loving husband, a nurturing father, a supportive brother, a loyal friend, and an eminent citizen of this great country. Thank you.